Let's talk about the vertebra, right? So there are different, we have, the vertebra is basically the bones which make up the spinal column. So in general sense, we have cervical vertebra, thoracic, lumbar, and sacral. Cervical 7, thoracic 12, lumbar sacral 5 5. Right. So now that is about the numbering and all that. So now let's come to the important part. So when you take a vertebra, right? So you take a vertebra, right? So there is basically a body. Anteriorly, there is a body. Right? I try to put an image of it possible. So there is a body, and posteriorly it becomes there's an arch. So there's an anterior body, posterior arch, and there's a pedicle that comes behind it. This connects it to the lamina, and the lamina expands laterally as the transverse process, posterior as the spinous process. That's as complex as the structure can go. Yeah, there are a lot of different other things, but you don't need to like complicate it here itself, because we will do that right now. After this basic anatomy, we'll talk about cervical, thoracic, lumbar, sacral. So here what we're going to do is, we are now that we have a basic idea, there is going to be difference at all these levels. And we're going to contrast those differences, and we are going to try to have an easy understanding of this. Okay, so now let's say you have this so we start with cervical vertebra, but there's you have to go according to a pattern, right? So I talked about the number. Yeah, we have talked about the number, so that is okay. There's also the curvature which we can talk about. Curvature in the sense, when it comes like into the body, so that is basically a lordosis. So you see these things prominent in the cervical as well as the lumbar regions, and the opposite, the kyphosis, you see in the thoracic and sacral regions. So lordosis and kyphosis. So if you take the cervical vertebra, so we have something like a lordosis. So now, in addition to that, when you talk about things, it's better to have some kind of order, so it's not that complicated, right? So that don't think too much. Think about the body. So we had to talk about the body. We had to talk about the transverse process. So we had to talk about the spinous process, some facets, functions. That's basically it. So when you're talking about this vertebra, just keep in mind you have to talk about those things. Right. So now let's go with the cervical vertebra first. So there are 7 cervical vertebra, and let's talk about the body, right? So the body is somewhat, it's small, can be oval, so it's oval shaped, and it has a foramina which you go along the transverse process, right? The spinous process are somewhat bifid. There's a triangular vertebral canal, and this one of its function is rotation, right? And it plays minimal role in weight bearing, but there is weight bearing, of course, but minimal role. So anything else you want to add here would be the transverse foramina, has the vertebral artery passing through it, and the C1 C2 is the C1 C2 forms the atlantoaxial joint, which is a pivot joint. Then C7 has a prominent spinous process. So that's pretty much related to the cervical vertebra. So now come to the thoracic vertebra. So thoracic vertebra, now in contrast to the cervical vertebra, they are obviously larger, but so there are 12, like I said, 12. There's a kyphosis. There's a heart. The body is heart shape. There's a transverse process, but there's no foramina here. And the spinous process is somewhat angulated downwards. You'll see facets for the articulation of ribs. The canal is somewhat circular here. Then you will see that it has more weight bearing role compared to the cervical vertebra. And finally, after this, now let's come to the lumbar vertebra. So the lumbar vertebra is again, so it's 5 in number, and there's a lordosis. The vertebral body here are somewhat very large, kidney shape. uh, so they have, the transverse process. There's nothing, no other features there, but the spinous process are pretty much flat. The canal here is again a triangular shape, the vertebral canal. And their important role is they play a very important role in weight bearing, largest, greatest, right? And then they don't really have rotation features like the thoracic and the cervical vertebra, so they're more of a flexion, right? Now come to the sacrum, right? Sacrum again, these things are five in number, but they're fused, and they form something what of a what do you say, kyphosis. So fused and laterally, they expand into a mass. So we talked about the body, we talked about that. Posterior, there's a crest. The vertebra, there's a small, sacral canals. So that is your sacrum, and they're fused. And their function is to transfer weight to the pelvis, right? So they articulate with, the iliac mounts and transferring weights. That's their function. So now come to the important things that you might want to just know. So C1 cervical vertebra has no vertebral body, right? And it's related to one of the burst fractures known as Jefferson fracture. C2, articulates with the C1 posteriorly at the end, and there's an ordinate process which can become fractured. So that is C2. Then C7 has a very prominent spinous process, and that is used as a landmark. Then come to the thoracic vertebra. So thoracic vertebra is one of the regions commonest for compression fractures. So that is one. Then if you were to come lower down, this is where you can have levels of disc prolapses. So the lumbar vertebra can have disc prolapses, and the commonest levels would be L4, L5, or L5S1. And then another important things that you might want to know here is the spinal cord ends at L1, L2. So the lumbar puncture usually given below the L2 level. Right. So the intervertebral disc is a secondary cartilage joint, and the commonest prolapse occurs posterolaterally because of the ligament weakness, posterior longitudinal ligament weakness. And when the prolapse happens, it can be related to sciatica, which is irritation of the nerve as it comes down. So based on the root value which is affected, you will start to see manifestations, whether it's on which side and which level. So you will have the motor as well as sensory involvement, which you can do according to the neurological examination, which I have also talked about in a very different one.